Hello, I'm Todd Unger, and this is AMA Moving Medicine, a podcast from the American Medical Association. With COVID 19 trends varying across the nation, patients have questions about how to reopen schools and concerns about maintaining physical distance. Dr. Wayne Grody and Dr. Tyeese Gaines discuss what they wish patients knew about physical distancing.
I'm Tyeese Gaines. I am an emergency medicine physician and also a school physician for 3 charter schools in New Jersey. And I'm happy to be here talking with you about physical distancing and COVID-19 vaccines and all the things that we hope that patients should know about this.
Hello, my name is Wayne Grody. I'm a professor at UCLA School of Medicine. My major specialty is medical genetics, where I see patients with unusual, undiagnosed, or very rare inherited diseases. But I also direct our medical center's molecular diagnostic laboratory and clinical genomics center. So, on that end, I've been involved in developing some new types of COVID testing for both the viral RNA and the antibodies, as well as starting to explore host genomic factors that might give us some prognostic information of which patients are more or less likely to have a severe case. I did want to ask you, make sure we cover it, since you're working with schools. Reopening of schools is such a contentious issue. If there's one group of people who are really being damaged by this lockdown, it is school children, both academically and socially. And, I don't blame the teachers for not wanting to be exposed. But what's your thought on how and when we could reopen schools?
Oh, that's such a tough question. And I'll start out by just saying I don't even know if there is a right answer per se. It's hard. I mean, if you step back and think about what school and the school experience is for children, it's not just about books and learning, right? It's about the socialization. There are plenty of kids whose parents or their one parent is stay at home. They could easily probably homeschool them if they wanted to. There's a reason why we send our kids to school. And there is some value in that, right? There's value in the socialization aspect in class with sports, with activities, leadership, learning how to speak and meet strangers, speak to and meet strangers. And I don't think that we should take that stuff lightly. So I get it. And I also think that depending on certain homes and certain communities, sometimes school is also a safe space. Sometimes school is the only place where some children are getting a healthy meal. School may be the only safe space that a child has if there's violence, domestic violence or abuse going on at home. So there's a lot of layers to it. I do get, and I respect that not having school really is doing to our children, and not to mention just the concept of being cooped up in the house too with children. Like I'm a firm believer that children need to run free and like open up the door and just let them run around until they pass out, and then they go to you could tuck them into bed. So there's something there, and I don't deny that.
Of course, the ripple effect of, parents who can't afford childcare, that they have to stay home from their job.
Exactly. And then but the other side of it, though, is that this is also a group, depending on the age. My son, he's a teenager, so they have gone back in a hybrid model. But, some of them, the ones that are upperclassmen, they're gonna be living on their own in college in 1 to 2 years, right? So that's a different population than a classroom of 3-year-olds. And so, I don't know the last time you've been in a room with, more than 2 3-year-olds, but trying to wrangle them and get them to sit still and get them to listen. I mean, on a daily basis, they're sticking their fingers in places they shouldn't and sharing food and doing all sorts of stuff normally that breeds the cold. Like what is the statistic that most kids get 13 common colds a year, and then each cold pretty much lasts 1 to 2 weeks. That's like half of the year, And that's normally, that's no COVID. That's not an immunocompromised child. And we have so many parents bring the children in, and I'm sure you've seen the same. They're like, something's wrong with my child's immune system because they won't stop getting sick. But it's, that's what it is. And so why does that happen? It happens because they're, kissing each other and hugging each other and, licking each other's pencils. And like, so, I'm joking, but I am also, being serious in the sense of, how are we going to make sure that these kids stay basically sterile, right? Like that they don't transmit things to one another. And so that's the part that is just tough. So what I've been recommending and what, a lot of the schools have worked on is just, trying to have plans where the ratios, where they can be spread out, where they're not taking their mask off unless they're eating. And then if they're eating, they're in certain areas. They're, when it was nice out, I was even making suggestions of, hey, why don't you move the cafeteria, quote unquote, to the courtyard, right? And just have them, sit in or, sit in chairs or just sit on the ground, even put out a blanket and just have them eat and socially distance, because we do know that the air movement seems to lessen, how quickly this thing is spreading. So have folks out there, keep them 6 feet apart, let them eat their sandwiches, or whatever they have, but try to use the outdoor space as much as possible. And then the other thing, even though I know we've gone back and forth about how, does it really transmit, as virulently or as strong as, in the air on surfaces. But I've just, I'm a huge proponent of just cleaning, periodic cleaning throughout the day, making it a game with kids and saying, okay, it's 1 o'clock. Like, when you would hear the church bells, right, ringing every hour. All right, let's play a game. Everybody let's squeeze a little Purell on our hands and watch them, or wipe down your desk, wipe down your pens and your pencils, especially, kids that bite their nails, kids that chew on their pens. Like there's just so many ways for stuff to get in. Um, so the most that we've been able to come up with is the physical distancing piece, the washing hands often at like a scheduled time, and not just leaving it up to kids to remember to do that, but periodically just saying, all right, every 1 to 2 hours, let's just wipe. Here's a, Clorox wipe or a Lysol wipe down your desk, wipe down around you, wipe down your chair. Those are some of the things that I've been suggesting to folks in their home as well as at the school, just to make sure that there's no inadvertent spread on any surfaces or in your backpack that you bring home and then grandma's there.
Yeah, I completely agree. And, you're certainly right in your description of especially grade school classrooms as sort of giant petri dishes. That there's even a theory, I don't know if it's been, validated, but that one reason the really young kids are mostly asymptomatic is because they've already had all the coronavirus common cold viruses, which have been circulating for years. They're like rhinovirus. It's just another cold virus, and there's at least 4 different strains of them. And the antibodies you get to those probably have some cross reactivity to the COVID virus. But as you were saying, that you can never be too complacent because it's true, 99 out of 100 or whatever it is, children will be fine. But then there's the one that gets that multi-system inflammatory syndrome, which is absolutely horrible. So you can't take any of this lightly.
Agreed. Yeah, I don't know. I mean, it's this is just such a state of uncertainty in general. We can't really make plans. We don't know. People don't know if they're going back to work or not, or they go back to work or they go back to school and then there's an outbreak and then now they're back at home. I've seen that happen a couple of times too.
I
It
know.
it's it's really sad, and everyone just keeps asking, when will we get to do things? We just had the Super Bowl, right? When will we get to just enjoy the things that are so-called normal? And I don't know, I think we definitely all agree that until new cases and deaths slow down significantly enough, that where we're not going to overwhelm the system, and more people are vaccinated, and so hopefully that will slow it down. Before any of that happens, I don't see us, going back to large scale events. But
I, yeah, I don't
it,
either. And every country, it's not just ours. Italy, all the ones that have tried to reopen too soon, they end up getting hit with this second or third wave that's worse than the.
Medicine doesn't stand still, and at the AMA, neither do we. AMA members are physicians like you who are shaping the future of medicine. Become a member today and join the movement. Visit ama-assn.org/moving medicine.
First one. I hate this term, the new normal, but I'm sure you and your colleagues have talked as we do. There are certain things that may never go back the way they were. One is, I think telehealth, I hope it's not the only thing we do, but the patients like it. They don't have to pay $12 to park at UCLA, of course, you can't do a physical exam, but I think we'll probably end up with a hybrid of telehealth and in person. And similarly, our medical meetings, which our AMA hosts probably aren't too happy about, I don't know if those will ever return to the attendance in person like they had. I think it'll be hybrid meetings where some people will watch it at home.
that's a good point. Yeah, I think we're gonna have a runoff. Like we're gonna have some residual, um, almost, if I could use it, a little loosely, like PTSD from this, in a sense of, I think people are going to like, even if we said, like New Zealand didn't have any cases for, a long time, right? Even if we got to that point where it was like 30 days of no new cases, I think people are going to be really nervous for a while. Like not everyone, because obviously not everyone is nervous enough now to be safe. But out of the ones that are, I think that's going to be hard to break. I mean, we've been doing this for almost a year. And so in some ways it's good, in the sense of, I think people are way more cognizant now of cleanliness, to say the least. Like, people would think about like a networking event, and think about how many hands you would shake at a networking event. And no one ever thought about anything, oh, maybe that person didn't wash their hands, or maybe that person has a cold and they don't know it, and now everyone's going to get sick. I don't think anyone even thought about that before. So in some ways, I think everyone, even though they didn't want to, has learned a lot about disease transmission. They had like a 101 like virology course over the last year. And in some ways, I think that may be a little beneficial once this is gone, just for all the colds and flus that we normally get hit. Because I agree with what you said earlier, that, this is not just the flu. However, there are some glaring similarities between how the flu is spread and how this virus is also spread. And so if we can just, learning this and understanding this, once we're out of COVID, if people still kind of keep some of it up, I'm not talking about full on, hazmat suits and mask and, hosing down packages in your driveway, but just being mindful of, you know what, I just shook a couple people's hands and I didn't wash my hand. Let me go do that and I'll be back. I think that now putting that into the forefront of people's brains may actually help us from the overwhelm that we get. I mean, in the ER, every flu season, there's a certain point where most years, not all years, we had a couple mild years, but in the last 10 to 15 years, we've had many years where the ERs are packed because of just flu. So I'm hoping that people are also learning how to not get themselves sick from all these other things that are out there too, and can protect their grandmothers and their aunts and uncles who have COPD and heart failure and all this other stuff, that getting the flu and getting the common cold isn't just a little thing for them. So that's kind of my positive hope on this. But I do think that people are going to be a little bit gun shy about just being in rooms with lots of people. I think that's going to take a while.
Yeah, especially people over 60 like me. I'm even though I'm vaccinated, I mean, I'm not going to get on a plane now. Maybe if this wave dies down. And you're right about the flu. You would know this firsthand better than me, but the last I checked, the prevalence of this year's influenza is way, way down. And they're saying it's because of the COVID lockdown. It's had the secondary benefit that flu is not spreading. Have
Right.
you seen that in your practice?
Right. I mean, from what I understand, it's out there. There have been positive flu tests that some of my colleagues have been getting on patients, but the yeah, I mean that it spread the same way. So if you're not out there and you're trying to not spread COVID, you're probably also not going to spread the flu or the common colds. So, I don't know what that will mean for people and their urgency to get a flu vaccine because now they might feel like, well, I'm wearing a mask 24/7. So, why should I bother getting a flu shot? I'm not going to get anything. I'm not even breathing air. I don't know what rollover that will have onto that, but I definitely think these are habits that we should have been doing from day one. And, like even people saying, "Oh, like, you know, I'm having to wash all this stuff and wipe things down and things from the grocery store." Some family members and friends, I've said to them, honestly, we probably all should have been wiping down things that we got from the grocery store. I will never forget when this first happened. I went to the grocery store, so it was either end of March or early April, and I watched a man pull his mask down, rub his nose, reach for the packet of chicken, look at it, and put it back. And so when you think about that, though, again, take COVID out of it. Take COVID out of it. You know what I mean? Like, there's just some things that we probably should have been wiping down before we put in our fridge anyway. I think the biggest thing is that I just want people to not get fatigued from being safe. I know it has been almost a year. Look, I am going stir crazy. I want to get on a plane. I want to hug my loved ones without a mask and without barriers between us. But it's still out there and it's still spreading and people are still getting sick and they're still getting hospitalized. So I just really hope that people can just hang on and still do the right thing and keep themselves safe and keep their family members safe and keep the strangers that they don't know safe that are out in public. That's probably my biggest thing is just I know that it's hard. I know all of this is scary. I know most of us are completely fed up with this change to our entire lives. But just please hang on until we can get through this. It's not the time to start slacking and not wearing masks just because you're tired of wearing it. We got to do what we got to do to get through this.
Yeah, that's my main message too. I know we're all fatigued, but as I said, I think the worst hit by that are really school children. The rest of us, the essential workers, are managing to work partly remote and partly in person. Um, and I don't understand the objection to wearing a mask. It's not that big a sacrifice. As the year of lockdown, it's been very frustrating for all of us. But think of the World War II, the so-called greatest generation. They went 5 years where you couldn't get a stick of butter or gasoline for your car. They made real sacrifices, let alone the ones that had to storm the Normandy beaches. And they didn't have Netflix to keep them entertained. We're just asking people to wear a mask and wash their hands, and get social distance. It shouldn't be that big a sacrifice. And just because you haven't experienced this disease firsthand, it is horrible. I actually wish people would post videos of a COVID ward and people could see when it is really severe how really horrible this disease is.
I do too, actually.
And yeah, Dr. Gaines, this was really enjoyable. We come from quite different specialties, but I think they complemented each other so nicely. And uh, if and when I'm ready to get on an airplane again, I would look forward to visiting you in New Jersey.
Sounds good.
I'm Todd Unger, and this is AMA Moving Medicine, a podcast from the American Medical Association. Get more insights from physician colleagues in the special edition of AMA Moving Medicine on what doctors wish patients knew about COVID-19. Find it at ama-assn.org/whatdocswish. Thank you for listening.